this meeting to order. It's Wednesday, December 19th, and please rise and say the Pledge of Allegiance. I pledge
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And we'll take a moment of silence to remember all the men and women who serve our country, both here and abroad, and those who have given their lives for us.
I'd like to also add the poor folks in Sandy
Yes,
Hook
thank you.
and Newtown.
Okay, thank you. So we have public comment, but since we do not have anyone here today, I think everyone's planning to attend our Christmas luncheon in about 55 minutes, which is where we will be as well. So I put the strategic plan discussion on for today because we did get at least one response to our RFQ, and I think a conversation with the respondent at this point would be helpful. Since we haven't made any awards yet, we won't announce who they are, but
Who do we have responded?
well, actually, we can say Carol Ridley.
She's the only respondent.
She's the only
right
one
now,
who
so
really
yeah.
responded.
Yeah.
CBI did not respond, and the other person who was contacted did not respond. When you do an RFQ, you just reach out to people,
Yeah.
rather than you don't put it out on a website or anything.
Yeah, the cost won't be.
But I think if we look at her proposal and just see Carol Ridley and just see if that really fits or meets with what
Do we
we
have the proposal?
She's
well, we
gonna-
can.
Oh, she's getting it to us?
Yeah, she's
Yeah,
getting it to us.
we just met with Elaine, and Elaine's going to send it to me, and I'll send it to you guys.
Mhm.
You can take a look at it. And I think that would be good. Is we should have a conversation with Carol so that you guys get what you want, and that's sort of the key piece of.
So I think the important thing that we could do today is to really set 2 dates, at least to start with, that we can all agree that we can meet, so that if we do decide to, that Carol is the best choice here, that we can offer those times to her. So let's
What
get the
dates were you thinking
calendars
about?
out.
What dates were you thinking of?
Well, we think it best not to do it at a regular meeting because it's a workshop session.
Also, your January regular meetings are full.
And yeah, they're already full with the
Budget.
with the
So
budget.
we'll have to do it,
So we could do it on a weekday. We could do it on a Saturday. We could do it in a late in the afternoon. Like
late in the
at
afternoon
4 o'clock. Or,
is fine with me,
Would a 4
or a
o'clock time
weekend
work?
is fine with me.
3 o'clock would work as well.
well, Sheila has. Remember,
okay.
she.
But
She has
what
some
I'm getting at
constraints.
is that late afternoon would be a preference of mine.
Right.
So
Just to mention a couple, I'm wide open the 8th, the 10th, the 11th.
you got my-
8th is a Tuesday, 10th is a Thursday, 11th is a Friday.
the 8th, the 10th, and the 11th. Yeah, those work for me.
8th, 10th, and 11th work for me as
Well,
well.
the 8th in the evening, actually,
Well,
I don't have, from 6:30 on, I don't have this Consensus Building Institute.
Starting at 6:30.
Starting at 6:30
Okay,
at
so what
Tuesday,
we-
so,
do you think
Okay.
Thursday
So the 10th or the 11th?
what about,
on the 8th, if we started at 4 o'clock, do you anticipate we'd be going over past 6 o'clock?
I would have to
She'd
be
have to
there
leave
by
at
6:30.
5:30, yeah. So,
I have a 6:30 meeting.
Okay, so
there.
the 8th is out.
yeah,
well,
we'll take
yeah.
it out.
Okay.
Yeah, so what
how
about the 10th?
10th is fine with me.
Fine with me. And
So-
what time do you want to start?
So, do you wanna say anytime?
Let's say
Say
3:30.
3:30?
Between
3:30?
3 o'clock on, just say to her.
Okay, all right.
So,
And you can do the same with the 11th if you want to do that.
that works for me too. So let's say the 10th or 11th.
Actually, from 3 on, as long as I know in advance, works for any day.
Okay.
Okay.
That's
And this is a meeting with Carol Ridley?
3 o'clock
Yeah, this is
on.
be
Well,
sort of
no,
a
this is the
So if you can
preliminary.
only meet at 4,
No,
or if she
no,
can
no.
meet at
This
5.
is to start the process. This
Yeah.
isn't to
Okay.
meet with her because you and I will meet
Oh, we can
go
talk
over
to,
that.
okay, I
But
didn't
if-
understand that either,
yeah.
okay. So this is sort of strategic planning session 1.
One
Okay.
would be on the 10th,
Okay, so, this is our last meeting for the month, right?
yes.
Yes, till the 2nd, and which you won't be.
When
And
you
I
won't
won't
be
be
here.
there, right, so you will forward the proposal from Carol, and we're meeting on the 9th, when we're restructuring.
Well, we'll forward the agenda, yeah.
Yeah,
I
and
think we have her proposal, which Elaine was talking about.
so we
You'll see
can
that.
accept
And we're
that on
meeting
the
here, right,
9th
this-
and
this
go
room?
forward.
We can do this,
Well, since it's
well,
a,
she's the only respondent, so we don't have to worry
Yeah.
about sort of when we pick it, you know what I mean? Because she's the only one that we got, so.
And if there's something we need to tweak, we could do that. Well, for one thing, what we'll do is Mark and I will go over it, and if we think that this meets the criteria, if we need to change it a little bit, then we get with the final draft, we'll send the drafts to you guys. And then if that meets with your approval, then we'll just go forward and have her do it and then meet with her on the 10th. How's that?
Mhm.
Because you don't leave till what, Christmas, well, you leave
I
Tuesday.
leave Christmas Day and I come back on the 4th.
So we
Yeah.
should be able to wrap it up by Friday.
Sure.
And we'll
Okay.
get it out to each of you by Friday of this week, if not sooner.
Alright.
Okay, so that's good.
And in the meantime, I wrote my stuff, I don't think I sent it, because I wanted to do an edit on it and I forgot to this morning. My thoughts on strategic planning
Oh,
going
yeah.
forward. Yeah,
did you get the,
I did get yours.
okay.
Mhm.
And then maybe do you want to try to just get the second one in case we need it, the second session?
That'd be the 11th.
We could do it the 11th, or we could do it the following.
Well, I think this is how I know how usually strategic planning people work. So they'll have a session, so
Right.
let's say it's
Yes.
either the 10th or the 11th. Then they'll probably want at least a couple of weeks to sort of put whatever pieces need to be done for round 2 together. So you guys may have some homework as well. So I was either going to suggest, well, the 25th we're in Boston for the MMA
Oh, yeah,
annual
that will
meeting.
work.
So maybe the 1st, February 1st?
I don't know if
I
I wanna
don't
go
wanna
out that,
wait that
no,
long.
I don't either. I would
Yeah,
rather
that's
go,
too long.
like, I would rather go out a week, or
Well,
go
I-
the 21st or 22nd.
Well, I don't know what Carol's going to say. She may say that's turnaround time for her is not good.
That's
I don't
fine.
know.
Well,
I mean,
I don't
if
know.
if that's what she says, that's what she says,
just
but I would
sort of-
rather encourage her
I
to,
would rather kind of schedule it for the 18th
Okay,
or the
I'm
17th.
open on the 18th, yeah.
okay, let's
Let's
do
do
this
the 18th.
18th as well.
So
All
let's schedule for the 10th
Yeah.
and the 18th. And then maybe we can
Actually,
finish
it's
it
the
on the
11th and
18th.
was it the 10th or the 11th? It's Thursday, right?
We said either one right
Okay,
now, and
alright.
it's sort of if Carol can't make one, then we'll go the other. So
So
just
the
hold those
18th,
two,
okay, the 18th is a Friday.
and the
Right.
18th is a Friday.
And what time were you saying on Friday? We're meeting.
Sheila-
Well, we
anytime
have it, we want to
after-
get it done that day. So maybe, but you still have fun.
You said after 3 o'clock?
That's right,
or-
at 3 o'clock.
Yeah.
Well, maybe we could do that if we had to have a supper or something and
Yeah.
continue on till 7 or 8 o'clock to get it
It's
done.
okay
Is
with
that
me.
possible?
Sure.
Usually there's not much other municipal
No.
stuff going on Friday.
Right,
That's fine with me.
okay. Because if we can wrap it up, that would be really good. And we may not, but we should.
Okay, so that's 2, that's good, yeah, that's
So
a
we're
good
good,
start.
we're good to go. Okay, then the other one is the, getting this budget policy put together. What I was thinking about was, I talked to Mark a little while ago, was to have Mark take the documents that we have obtained, the ones from, Falmouth's budget policy, the one we got from Nantucket, and to draft an outline of the, or come up with a draft for a budget policy that includes a paragraph relating to total budget expenditures, a percentage of what we want to spend and any
Yes.
increases for that particular year, and then going into the issues of revenue, expenses, capital funds, reserve funds, stabilization funds, policies around how those funds are utilized, how they're going to be funded, and how they can be used, just as an outline of a draft of the policy.
Mhm.
And then I was thinking that once we had a draft, to invite a couple members of the assembly, the finance committee, to join us, to join
Discussion.
the little working group
Yeah, I
to
think that's
start
good,
with,
yeah.
to go over the draft and, and then come up with something that that the group thinks is workable, and then present it to the commissioners for their review.
Maybe 2 members of the finance committee or something.
2 members of the finance committee, Mark, maybe someone else from the staff, and a commissioner.
Well, I think that might be a useful thing to do. My only concern, caveat, is that we might dwell on recent events with regard to FTE, additions, and let's say, and get involved with, let's say, I would
That's
not
not
want it to
part
have
of
it
a budget,
appear.
that is not part of a budget policy.
Well, my point is, I do not want to have it appear to be an invitation for them to perform what I would call a strictly executive branch function. That they would, I think their input would be welcome with regard to understanding what we're looking at as far as the, what I'd call the application of the revenue sources that we anticipate, but at the same time, I'd say
I understand
I'm
what you're
jealous
saying.
I'm jealous of my authority with regard to
Yeah,
this.
well, remember, this is a draft, it's a policy, so these are overarching statements. These are not in the weeds. It doesn't determine how this gets spent or that gets spent. It's an overarching policy regarding the general
Okay, well-
allocation of
This
funds.
is a blind alley, but when you guys did it in Falmouth, did the selectmen talk to the FinCom before you finalized the document?
Yeah.
Yeah. I would think that you would do that, sort of as a matter. I think the selectmen
matter
and
of
you get the
courtesy.
final
I think at the
decision.
time that they were invited in, it would be after we had, let's say, gotten some sense of where we were, and then in the same way as you would go to the FinCom, you're looking at
Here's a
what-
draft. Yeah, we have a draft that we've agreed basically to a
Yes.
draft. Then we have, when Mark has the draft together, then we have the meeting with a few others to review the draft and see what they think about it. Do they have any other input? What do they think might be helpful? Or what do they think maybe is there that doesn't need to be there? Something like that, but to begin to engage the assembly in some of the things that we do at that level.
Okay.
Is that okay?
All right, so I'll put an outline together as a start. I
As a
planned
starter,
on doing that as well anyways, but I just never got around
Yeah.
to it for this week. So
Yeah,
I'll put an
'cause
outline
that
together,
makes
we'll
it
start.
really
That's
helpful
sort of
to
the
do
elements.
that.
I think the Falmouth one is very useful. I did send you also, I think, a GFOA one that was a little more 10,000 foot level. It was really at the policy level.
And that's what this should be. This is really a policy level. That's what it is. It's a policy.
There was the Nantucket thing, so there were 4 pieces if I remember. And then Bill had found the NACO one, which I think was more strategic plan related. If I'm
It may well be. It was the only thing I found that had, that was in the publication, inventory. At the same time, I sent, and I think I copied you on that, I sent a request to their research division
Yeah,
to
right.
find out some evidence of best practices that they had, they'd come across, because they do give awards for planning. So I have not heard from that particular person. I'll follow up on that between now and the next meeting. But in any case, I think I've got that process started. NACO has been a good resource for a lot of that stuff, and I think in reading the
I
what
didn't see
very
that.
general-
You emailed it to me, did you? No.
Yeah. No, I think you did.
Oh, you did?
I think I did, yeah.
That was
okay.
the publication.
one.
Yeah, it was a PDF.
Yeah.
The other point I wanted to mention too in our budget policy, I think we need to consider grants. Because I know that some of the departments utilize the grant process pretty well, like George Hoyfelter, he gets a lot of grants. Obviously Darlene does, and then, other groups and grants. We know the commission gets a lot of grants, but
Human Services.
from the county level, I think,
Beth has been very good at it.
and Beth's been great at getting grants. But I think that if we can raise it to another level and see what we may be able to get
Administrative grants.
as a county, more in administrative grants or planning grants for us as a county government that we can utilize, especially now that that we're moving in a lot of directions that are like in the area of wastewater and water and all of that. And the technology part of it is, those grants are coming forward, but the overall county planning grants, even, I think that we might find something, and this might help us in our revenue side. The other thing that we, I think, should look at may not necessarily be well stated in the policy, but something we can look toward is how we accomplish a more sustainable revenue for the Cape. And I'm thinking, particularly in terms of the projects that are being worked on now, like the RUS project, which are the regional umbrella services that we may be offering to the towns, where there would be a fee, if you will, and that we should begin to, in a policy statement, take a look at how we might pursue these fee structures for services that we're going to perform that will provide us with a more sustainable revenue source. Something along those lines.
Are they not doing some of that on this group that they're putting together?
Yeah, they are, but I think from our standpoint, that we need to be, that's one piece
Has
of
to be
it, but we need
coordinated
to be
with us.
looking, yeah.
You might wanna have a policy about it. Yeah.
Have a
Right.
policy
Well,
about
But that way we would have to meet
grants
with them and discuss what they're doing.
and fees
We're
for
trying to hash this
services
out.
that we should even be looking at the services we provide now. How many of them are provided simply because we're here and we don't charge for them, but going forward, we're going to be doing a lot in the way of providing services to towns, and we should be looking at some sort of a fee structure for that. Because they're probably paying for it now from somewhere else.
Right.
And
Yeah.
if they purchase that service from us, then we should have a fee, which would then generate a sustainable revenue source.
Plus, some of
something.
them are sort of have, so we're in a situation where some services, some of them get charged for, some of them don't. I don't wanna sort of say that too loud,
Right.
but it's sort of historical. Well, we never charge them for it, so we don't. But, we've always charged them for it, so we charge them, you know what I mean? It's
Right.
exactly.
Yeah, we have to
Yeah,
take a
so
look at
we
all
need to
that.
really-
No, we really have to take a look at all that.
Yeah.
And what of those
That's a
services
very
are they
important
worth
component of any
continuing?
policy study that we do.
Yeah.
Absolutely,
Yeah.
yeah.
Because I think that the guidance for policy has to do with how we, how we look at our revenue sources and revenue streams, and what weight we put on what the expectation is for a community that is giving us revenue. The 2.5 million that we get from the towns based upon the property tax, which comes from, the property tax in the towns. How much is that should be determined to cover our cost in providing the services as far as going back. I think the policy might be an analysis of what it cost us to provide services in each one of these areas.
That's the whole idea, yeah.
To go back to the grant one, Darlene just sent me her 2012 spreadsheet for all the grants that they've applied for the past calendar year. So I will send it to me as part of the budget.
Yeah.
But I'll send that to you ahead of time so you can take a look at it. But sometimes what happens is you sort of see the grants you get because you sign a grant contract.
Yeah.
But you don't see everything that we don't get that she's applied for. So when you see that big spreadsheet, you can kind of see that because usually the RDO's focus is on where the money is. So you can kind of see over time how the shifting priorities for the grantors is. So I think you'll see it's more technology related now, and it's less, frankly, it's less human service related. So, but that's a good thing for you guys to look at.
And the other thing too is that there's money out there for regionalization, and we're on the cusp of really moving in that direction in a much broader scale.
That's true, but when that was presented before, when the lieutenant governor was down here, we were excluded
I know,
from it. So I
Well-
think we have to get past that.
we do.
Well, they've changed that, so that's good. But you're right.
But
So,
that's where the money is, so
Counties
that's
are
what we should be targeting, is that money that's out there that we know we would be eligible for. So, and we need to find, that was one of the charges we made to the special commission, that we need to find a sustainable revenue source so that we don't have to wait with bated breath to see how many houses are gonna sell in the course of a year.
Yeah, it's not very stable.
No.
No.
Okay.
I can add one thing sort of along those lines. I got a call from Dan Matthews, who's the county administrator over in Norfolk.
Oh, yeah.
Oh, yeah.
And, you know, they're looking at the legislative agenda for the upcoming new State House session. And so he sent me some information, and they are looking at the fee for the registry as they want to file that legislation again. You know, they filed it at the previous session. But he also asks if we would be interested in hosting a regional meeting in Barnstable for county officials, Cape and Islands, and other the counties that are left, Plymouth, Bristol, Norfolk, and maybe meeting with some of our legislatures.
We did that several years ago.
I think
We
it would
did.
be
It
great.
was
Yeah.
quite well attended and quite well received.
We did one on the Vineyard quite a few years ago. They've had them in Plymouth.
Yeah, I was
a
the
couple
one in
years ago.
Plymouth about 3
Yeah,
years ago.
we should do
All
it.
right. Let me see if I can piece this together. I'll ask
Yeah,
Karen to-
and have a
And work on
really
an
nice,
agenda?
Yeah, we'll work on an agenda. We'll do it at maybe at Cotter or
Well, actually, we met across the street when they were here before.
oh at the
What's across the
street? The,
Barnstable Tavern.
At the tavern.
Yeah, well, we'll see. I mean,
Well, maybe,
it's kind of broken up into pieces. I mean, it's
If-
just,
if
it all
we-
depends on how many people respond.
and
Yeah.
it depends on what kind of an agenda we have too. If we have an agenda that's really gonna bring a lot of county officials from around this part of the state, we may want to include other participants in it.
Well, I'm thinking about maybe having part of the agenda something like a little presentation, like what's going on down here in the 911 dispatch would be an interesting thing to talk about.
Could it be that we
And the
could have a
governance
combination meeting with
committee?
the,
Yeah.
That's
The
made up
town
of town
councils.
managers.
Yeah,
That's a
SIO,
pretty
yeah.
unique.
yeah. So we have a couple of those things, and then talk about sort of this drier,
Mhm.
the legislative agenda.
Mhm.
So,
Yeah, if we could have a couple of really good, attractive topics that would bring other people in as
Yeah.
well, and other people from the Cape in as well,
Sure. Yeah.
to actually see what's going on in county government,
All right.
not just here but elsewhere. That's a good idea.
Did he mention anything, where they are on that Fannie Mae?
I did talk to him about that. Yeah.
And where are they?
They've chosen to go with separate counsel.
Mm-hmm.
He said, I said, well, we were looking at going with the Attorney General. He said, has the Attorney General done anything? I said, no. I said, if they haven't, and my thought process after talking to him was maybe we should put a deadline. If the Attorney General doesn't do anything, then we go with a private firm. They're on a contingency basis, so that they don't pay anything out up front. They get a percentage or whatever is
My question, my concern about going with the Attorney General is that you're letting the state take the lead, and the state isn't gonna, we're not gonna benefit from that if we don't speak for ourselves.
Well, we should, because the piece of the deeds that we're talking about is ours specifically.
That's right. So I don't think the state's gonna go out there and start swinging for us.
Well, the state has a lot of money at stake.
They do, but
Certainly
that
more than
doesn't,
any
their
other
interest is in
entity.
to make sure that we get that.
Well, our interest is to make sure that they pay attention to us.
Maybe we need to make a contact call to the Attorney General's office.
Yes, I think so,
See what
yeah.
they're doing. The last time I understood, they knew about it,
were-
they hadn't
yeah,
dedicated any resources to
No.
looking at it, it was kind of off there.
wasn't on their
And
radar.
maybe see where they're at, and then, but we should get it on our agenda within the next couple of meetings
Yeah.
at least by mid-January to take some action on it.
Yeah, I think that's
Yeah,
a good
and not
idea. If
to
they
like
don't do anything
put
by
it on
X
the-
date, then we'll just
You're
decide
back on the
to.
9th, maybe on the 16th,
Yeah,
put it on the agenda for the 16th.
Sure.
That way we should have all the information we need.
all right.
Deeds. Okay. Anything else before I know you're not up to,
I also have a question about on the summary,
Okay.
to execute a contract between IT and Plant and Morgan to provide counseling
yeah,
for implementing a comprehensive set of IT policies in the amount of $24,000. So,
did you
I don't
tell us
understand who
what
these
that's
people
about?
are, yeah, who are these people, why are they doing this, and, I mean, why are we spending this much money, and, I mean, the other thing I wanted, before we even get into that, you know, we are, having a consultant do our website. I do think that we have to be very involved with that. I don't think it's just Mark You know, I look at Mark as the operations guy, he's the guy that connects all the wires. This is something that is a
John?
portal,
Mark?
John. And this is a portal, as Bill said the last meeting, that this really represents and reflects us. I think that we have to have a lot of discussion. I would like to have a discussion before this woman gets started, just to see what we would like and how these things integrate and we have a uniform look.
Some
one
ideas
department to
of
another.
what it's going to look
Right,
like, so we
exactly.
have some idea.
Yeah,
what
I
it's
think
gonna
that
look
we
we
need to
said
be a little bit
that
more
was
in
clear,
control of
that
that.
they're
I thought we made
bringing
that clear last time,
back.
but I think that, I don't think it bears repeating. And as long as we continue to have the focus on making sure we get what we want, because we certainly have heard a lot about it.
Yeah, I just don't want it all be going on without us.
No, we wanna get
I wanna
something
be
that
there
you
in the
guys
beginning.
like and that
Right.
you guys are comfortable with, and that's also consistent sort of between, you know, the main portal and the health department and the cooperative extension and all the others.
Okay, so
Yeah, you
that's
did
it,
clear
we'll
on
go
that.
back
So-
to number 17.
So her question is,
17.
who are Plant and Moran, and what policies are they going to be developing?
Well, they're an IT consulting firm, and the reason that we're bringing someone in outside is because a lot of these IT policies and procedures have to do with sort of, you know, we have record keeping that we have to be careful about. We have HIPAA records, we have social security numbers, and so in terms of developing your policies, you have to make sure you consider all of those sort of security issues, HIPAA issue, whatever other types of things. So John wanted to bring someone in to help him do that when they're developing the IT policies.
It's a very fluid situation too, and I can't imagine that, you know, our IT people would keep up with with what the Commonwealth continues to change with regard to how we're supposed to deal with electronic records.
So what's the product? What actually is the
A
product
set
gonna
of
look like
IT policies and procedures on
for,
how, well, how governs the request of electronic records, or how it governs how you keep electronic records, or
Well,
how.
did we have, in a sense, we have an opinion on that right now, and we have some policy information.
Yeah,
Is
we
that
just
the
don't
better
have it
way to
all
go?
cogent and
Right, so
pulled
maybe we
together.
should be looking more at our attorney, who we're going to retain as our county attorney before we go ahead and
And
make
they'll
a
have to
contract
be
like this.
reviewed by council as well, there's no
Right.
question about that, yeah.
Right.
Yeah.
I don't think that attorneys really specialize in that part of the law.
They
Well, they'll
do.
have to look at
They are
certain
our
aspects
specialties
of it,
now,
Bill, to make sure you're covered on your records retention and records requests,
That it all
open
hits
meeting,
federal
all that
law,
stuff,
state
yeah.
law, municipal law.
So that's what they're doing.
so this will run through November of 2013.
Yep.
Okay. I'm ready to, I'll make a motion that we would support it.
I'm not sure about it.
What, well,
When do, we have to have this before the year is out, right, from November, so what, do we already have them employed?
you know, obviously
No, it's the
not, because we
contract,
haven't
contract's
approved
probably in your folder.
it. I'm afraid of, you know, hiring, you know, a lawyer for this, a lawyer for that, and a lawyer for the other.
No,
Well,
that's
they're
what I
not
don't want, I
aware.
just wanna have, yeah, they're,
They're not a lawyer,
That's what I mean.
they're,
So it seems to me that, that the, and I hope you know, you did that review, that you have at least vetted out to the degree that you could, that the service that they would be providing is one that would bring us up to date with what the Commonwealth of Massachusetts and the federal law requires with regard to record retention.
if I wasn't comfortable with it, it wouldn't be in your package,
Okay,
so.
well, on that basis, I'm going to go ahead on it.
can we defer this? I mean, how,
It's a long time
I
to
know it's a
defer.
long time to
It'll
defer it,
be-
and
it'll
we're
be
not gonna
over a
meet
month
again.
before you come back.
Well, I think maybe what we could do is, maybe we could approve it, but I think we need more information about it. So maybe we could schedule a meeting with John to describe the contract and what the outcomes are.
On the, yeah, have them
Or-
come in on the 9th.
I think it would be, I mean, I know the money in some respects seems short for depending upon the product.
Mm-hmm.
But I know that producing those products do cost.
Yeah, and
fair
it's
amount
not
of
like
money.
that, I just wanna see where we're coordinating all these. I mean, I just feel that we're sort of on the cusp and we're jumping into putting that much money here where we could, in a month, say, gosh, if we had done this all.
Yeah, I'm
If we had
just,
stepped back and taken a look at this, we could have had this more,
Didn't this grow out of a requirement to meet some?
well, we
something
need
from the
policies,
state?
there's no doubt
Well, no,
about it.
This was in John's budget from 2013, that's what he's working on.
Yeah.
And it's-
And
Oh, so it's within
It's-
his
it's
budget,
within
the
it's
budget.
just
Yeah.
Where would
approving the
24,000
Just
contract.
come
accessing
from?
it.
Yeah,
in other words, when we approved his budget, we charged him with doing this.
Well, I think, yeah, so I think
Alright.
we should go ahead and do it, but then
We'll
get from
revisit it in
him
the beginning, yep.
a report on what all of these
What-
policies are going
yeah,
to involve,
and
and a review.
And maybe even discuss, meet with these people.
So there's a second.
Second.
Any further discussion? Okay, all those in favor say aye.
Aye.
Opposed?
so that's the summary, right?
Right.
Right,
So
that's the
you have
summary.
to do the minutes, although you wanna defer till after. Yeah,
I would.
just to
Yes,
because I
we'll
haven't read them.
defer them.
And I have one other thing I need a vote from you guys on.
Okay. Afterwards?
Approval. Yeah, I just don't want to forget.
Do we have to
Yeah,
do a
since we
vote
are
to defer
right-
the minutes?
No,
No,
Okay.
no, we just have I think we ought to send that over to the water collaborative.
Well, I want to welcome all of you today in this holiday season to meet with us, and I know Beth, is it Beth, you're going to make the presentation on the human services trends? I know, talking about websites, we find your website to be extremely valuable and helpful and very well put
Hi there.
together.
Hi, Mark. One for each.
You have so gosh, that, thank you, Bill.
Thank you.
I have some additional copies, and then these are just the one page, so that's a more complete copy. So, good morning.
Good morning.
So, I am here this morning to report from the Health and Human Service Advisory Council. We have a government liaison subcommittee. And I've asked Christine to assist me to give you a snapshot of the demographics. But before I begin, I just want to, we have several members of our advisory council here. We have Kate McHugh from Freedom from Addiction Network, Kathy Petronomy from the DA's office, Beth Costa-Ciavola from Cape Cod Neighborhood Support Group, BL Hathaway from the Oral Health Excellence Collaborative. Raise your hand, BL. And who else? We have Mary Lou Pettit
Everybody knows.
and everybody else. Everybody knows Mary Lou. Okay.
The usual suspects.
There's some seats.
If you want to sit.
So I prepared full packets for the commissioners, for Mark, and for members of the advisory council, and I have also prepared one-page summaries, which are being passed out. So just a little background before we begin, and then I'm going to ask Christine to kind of set the stage with some demographic information. In the fall of 2011 and early 2012, the Health and Human Service Advisory Council undertook a strategic review of its purpose, function, and structure. As you know, a primary purpose of the Advisory Council is to inform county government about health and human service needs in the county of Barnstable. So in order to meet this responsibility, in August of 2012, the Government Liaison Subcommittee of the Advisory Council issued a questionnaire to all of our Advisory Council representatives. And in the full packets, you'll see a list, there's actually not a list, a visual of all of the different Health and Human Service Advisory Council members. We have 26 different groups, consortiums, networks, and organizations representing a wide array of health and human service sectors, if not all of them, in the county. So we undertook a questionnaire soliciting feedback on emerging trends, needs, and policies impacting our advisory council representatives. And we received feedback from 19 of the 26. I have summarized or compiled all of those responses in the last attachment. I didn't think we would go through each and every one of these points today, so what I have in this memo to present to you today is a summary. So before I begin with what emerged as emerging trends in kind of funding picture, I'm going to ask Christine to give a brief demographic overview of Barnstable County.
Hi, Christine.
Hi, good morning.
Good morning.
Hi, thank you. So I don't have a handout today, but we will have one in early January. I'm in the process of putting together what I think we could call a white paper on the socioeconomic well-being of Barnstable County. And so where I'm at right now is really thinking through how do we tell the story for Barnstable County? What indicators are the most useful to tell the story? And how do we look at both sides of it? Because when we look at some of the kind of income side of the indicators, Barnstable County often doesn't look so bad. But then when we look at the cost of living indicators, we can see why so many people are struggling. And I think that's the red thread that you will see through what Beth will be sharing with you. So I'm in the process of putting together this white paper, and I'm looking at Barnstable County over time. I know this is not something terribly new. Other people before me have done it. I'm going to do it in a slightly different way. But I'm also comparing Barnstable County to Massachusetts as a whole, because some of the things that I started to see as I did this analysis is that, you know, we're faring in the same way that Massachusetts is. So I just want to keep that in that context there too. I don't want to take a whole lot of time to do this, but I think the what we already know are, you know, some of the trends in terms of the population is starting to go down. Where it's going down is we're losing children in young families. Our proportion of the population that is 65 years and older continues to hover around 25%. One of the things that we have noted in some of the recent analysis that we've done, and it's something to keep an eye on, is for the first time we saw a drop in actually an 8% decrease in the population aged 70 to 79. So I think that this is just something we need to be keeping an eye on as we go forward. There's nothing that we can call a trend yet, but it's an interesting blip.
Sorry, decrease?
A decrease.
Oh,
So
yeah.
so our population 65 years and over continues to hover at around 25%. What we saw was the population 85% and over went up a little, but the population between 70 and 79 actually went down. From 2000 to 2010 went down by 8%. So the change in the population 65 years and older, and in fact 55 years and older, has not been as great as originally predicted, with some interesting other blips that we need to keep an eye on.
What was the 85% people who are 85 and over? No.
The 8% decrease is in the population 70 to
79. That's an 8% decrease. And what did you say? There was something at 85%.
No, I think it's
No.
25.
Oh, 25% is the overall
65.
population
It's
itself.
remained pretty consistent.
Okay.
Right.
All right.
If the 55 and over are not increasing, that means it was 55. I think is like the window when people start to move down here, you know, year round, right?
Well, I think some of what we will be looking at and monitoring over time. One is, are people still moving here when they hit retirement age?
Mm-hmm.
Are people staying here who have lived here in their younger adult years? Are they staying here when they retire? So I think those are a couple of trends to keep an eye open on. And then also this decrease of 8% in the 70 to 79-year-old group, that suggests some migration out. So are even some older adults deciding that they're going to leave for
Be closer
whatever.
to family, to be in a warmer
Yeah.
weather.
Yeah.
To avoid
So-
the cost of wastewater.
To
Yeah.
avoid the cost of just living.
Yeah. I mean,
So
truly,
that is
a lot of
that-
costs coming up for
Yes.
people who live here.
Yes.
Or it's
So
just that they were hit by the recession and
Well, that's true too.
Which
yeah.
is where
can't
I can
afford
go
it, so they
next.
move where they can
Yeah.
afford.
So that's probably a good place to go next. I by no means want to take away from the importance of all the work we do for that age, for older adults. We've still got numbers that exceed populations in other counties. It's just something that it's a population that hasn't grown as fast as we thought it would be, and it's something to keep an eye on.
Okay, so we're still representing God's waiting room for Massachusetts.
Right. So just to look at some of the income, the cost of living piece of this. So one of the things that, as we continue to note, is that the median income for Barnstable County, and this is using 2011 estimates from the American Community Survey. So the median income, all sources of income for Barnstable County in 2011 was $56,699. For Massachusetts as a whole, it was $62,859. So our median income, we start right there, our median income for the county is lower than for Massachusetts, but we know we've got a higher cost of living. Then when you look at households where there's, people are employed, so we look at the mean income where there are earnings in the household. The mean income was $69,401 for Barnstable County, contrasted with $90,376 for Massachusetts.
Wow, that's
So
a big
again,
difference.
quite a big difference.
Well, it brings up another question in my mind, where if you're, with the amount of retirees that are here and the fixed income that they're on, is there any attempt to segment among the income of those, let's say, of those younger families who have who in order to afford a house have to have an income, let's say a
That's right.
family income of about 100,000, let's say, in order to be able to, or to buy a house based upon what we know of the let's say the so-called average or mean price of of housing down here. And it always occurs to me that when you retire, you also have paid off your house. You don't have that, in many cases, you don't have that burden, to cover. But one of the things that we talk about in terms of retaining people here in that age group that that seems to be leaving is that what do we know about their income? Because I think there was an article in the paper this morning, I think, that talked about how the younger, the unemployment among the younger segment was substantially high, and they were not moving into what I'd call livable income opportunities.
Correct. So segmenting this and breaking this down into smaller pieces, unpacking it, as I like to call it, is something that I will be doing. I don't think we have time. I didn't prepare all that for today because I didn't think we would have time.
No, this is just the bullets to kind of
Yeah, I
set the
get it.
stage for the advisory council. I think what would make sense is for Christine to come back, for us to come back when the white paper is finished and present it to you as well as the assembly.
But Bill, what you mentioned is right on. When I look at earnings data and you look at it, by age group, the earnings data for those young people who are employed, their earnings are
Very
are
low.
lower. I think just one thing to hit on, as I said, I was kind of keeping it at the high level for this presentation, is that I took the 2012 average weekly wages for the first quarter of 2012. That's the latest available to me. And the average weekly wage was $808 for Barnstable County, contrasted with $1,227 for Massachusetts. And again, when you start to break that down and you start to look at it by age group and you start to look at it by employment sectors, a lot of it becomes very clear. Younger people are working in tourist industry, retail industries, variable hours, lots of hours in the summer, not so many hours in the winter. Double the unemployment rate here in Barnstable County in the winter contrasted with the summer. So we've got a lot of that dynamic going on.
There's another interesting statistic too, and that's the EQV in terms of properties.
Yes.
The equal valuation. And of course, I'm more familiar with Falmouth, so I always say that. But the EQV in Falmouth is $11 billion. That is the same as like the town of Westwood or Weston in terms of value. But when you look at the taxes that people pay here and the incomes, no way do the property taxes or the incomes even support that type of an EQV. And it puts us in, and there are other towns that have similar EQVs, I'm sure. Chatham.
What does NQV stand for?
It's the equivalent valuation in terms of property. And it's right in the, the MMA, they put out
Yeah,
their
I do.
annual
I was just
journal
like,
every year, and the
a lot of
EQV
people
in every
don't know.
town is in there.
Cool.
And the property taxes too, and that has a huge effect on the people who work here, who support whatever that might be, because all the most of that valuation comes in the properties that are on the water.
Now, I'm waiting to see whether there'll be some introduction of the Women's Industrial Union, analysis with regard to, economic stability, because those always seem to be closer to the bone with regard to what we should be looking at, rather than what I'd call the federal and the state measures, which don't take into account what it really costs to have daycare, what it really costs to have transportation, and all the things that that fit that in.
And that's what I was mentioning about making sure that we have the right set of indicators in here, and that is definitely a source of data that I use. And again, it's very telling when you look at what a family of 4 needs presently to live in Barnstable County. One child in daycare and 1 child in school. It's about $68,000. So then you look at the wage side of things. That's two parents. If it's a two-parent household, working at least 1 full-time equivalent each.
Yeah,
To
full-time
even come
employment-
close.
Yeah, full-time
even come
employment on
close.
Cape Cod is 3 part-time jobs.
Right, exactly. So, yes, that is another source of data that I'm using. Would you like me to
There are a few other
spell
just
out,
bullets that
um,
the poverty.
Yeah, I think,
The poverty
the
rate,
poverty,
just quickly, and
right.
because I
So I think that's another,
Close to lunch. The poverty.
so in the poverty, I think this is also very telling of the change that the county experienced from 2006 to 2010 with the economic downturn. In some ways, I think Barnstable County caught up with the rest of the state. Prior to 2006, the poverty rate on the Cape had been relatively low, contrasted with other counties. We caught up. So from 2006, the poverty rate was 5.1%. By 2010, it was 11.3%. So that's that's more than double the number of people in poverty, percent of people in poverty. It started to come down a little bit. The 2011 percent of people in poverty was 9%. But I think we also have to talk about how many people is that. That's almost 20,000 people.
Right. But it's also good to say, what is that poverty threshold? What is that? What is that amount?
Yes.
Because
What does that
it's
mean?
staggering how low it is.
Right. Right. So for a family, since many households that are in poverty are women-headed households, I'm going to use a family of 3. So it's $19,000 for a family of 3 in 2012. So that doesn't
That's
go
the
very far.
poverty level?
So
That's
that
the poverty
is-
level.
yes.
Good.
you're
Yeah,
right.
so you,
Yeah, I guess.
Could you say that number again?
For a family of 3, for a family size of 3, in 2012, it's $19,090 to be right on.
so 11% of our citizens are trying to get by on $19,000
It's
a
actually
year.
now 9%. It was 11 point.
Right,
The
it did
highest
go
it got
down,
was
yeah, it was
11.3.
11.3,
Yeah.
right, I remember that
Yeah.
statistic.
But I think moreover is that, and this is a statistic we use a lot when we're estimating how many people are participating in using our food pantries, is the percent of the population below 200% of poverty, again considering how much it costs to live here. And 200% of poverty, that's not a huge amount of money. For a family of 4, it's $46,000. But we have 1 in 4 of our households are below 200% of poverty. So that's about 51,000 people. It's also really striking that for children, in 2006, so children under 18 years of age, in 2006, the poverty rate for that group was 3.4%. It went as high as 18% in 2010. It's starting to come down, it's now 16%. And that aligns very closely with what we're seeing when we look at the participation in the USDA free school lunch program. And about 22% of students are participating in the free lunch program. So that means they're below 130% of poverty. And then we've got an additional 4% who are participating in the reduced lunch program. So when you combine those two, again, it's about 1 in 4 students either receiving a free or reduced school lunch. So You know, I think I thank you for the input you've given me and sort of the other things to really make sure I'm thinking about.
There is one concern that I have is that
Yeah.
even with as dire the measuring, there should be some way of identifying those emerging job opportunities that would lead to livable income, and I think that's an important thing to know. I've been in conversation with some kids that were looking at what would they do as far as getting to be fishermen, shell fishermen, and also protecting the shell fishermen jobs that we already have. Is that appears to be a lower technology approach to providing an opportunity for livable income, and it's available to women as well. But the point is that we should be able to identify what is realistic to look at on the Cape with regard to let's say livable
How can we make this
income
better?
opportunities, not just jobs,
Right.
not just jobs that are $10 an hour. That's, as you've already pointed out, $10 an hour is the poverty line, isn't it? 2,000 hours a year, so it's less than $20,000.
Yeah.
So we can't. We have to measure those, but we also have to look at that window of what would lead. Can we identify the path that we can take in order to get to that level of livable income, so that people can actually afford to live here based upon their willingness and their interest in applying their skill and their work ethic to get that done.
So I just want to close in saying I don't think it's a hopeless picture by any means. I think it's just being realistic about where we've been and where we're going.
And you're going to find that people will get very uncomfortable with those numbers because they don't like to think of ourselves in that way. And but that's why it's very important to state them and to really break them down to see that it's not just 25% or 10%, but when you put it all together and how many people that translates to, we have some things to
But they are
take care of.
indicators, and they're important indicators to know what they are. And I'm going to go back again to an indicator in Falmouth because I'm familiar with that. If you want to apply for the CDBG Community Development Block Grants for a community for housing rehab, you have to meet the average. You have to be at or below the average income, which last year was 39,000 something. And believe it or not, Falmouth met that average income. And then this year now it's 40,000 something. And so the town just went over that amount marginally and now is not eligible for those CDBG grants. But you think that the average income in a town with $11 billion in EQV, and that's what the average income is. So these indicators tell us that we have a lot of work in terms ahead of us as to not only how to improve those, but what legislative action we need to make us more eligible or more viable in terms of the services that we need to make life better for the people who live here in many, many different areas.
And I think what you were saying about property, more than a third of the property, I'm not speaking just to Falmouth, is
Right.
seasonal.
Yeah.
So that pushes that.
Yeah, it's the coast,
amount
the coastal
And
properties.
don't lose sight of the fact that CDBG money has to be fought for every
Yes,
single
every
year.
side, right.
Right, so.
So, well, this
That's a
is.
good
Okay,
segue.
That was the setting the
good-
stage.
yeah.
So it's, are you adjourning it?
That's okay, we have.
Yes, we are
have a few
joining you,
minutes.
We're not gonna
and we
run out of
need
food.
to.
Yeah, okay, but go ahead.
But please do come back though when you.
Yes,
when you
Christine
have
will
it
come
all
back and
together.
do a full-on
Yeah.
presentation. So getting back to the advisory council and what was identified as emerging trends based on the questionnaire and the results that were received. So I bulleted a few of them and have attached all of the compilation of all of the summaries. So the following themes were identified throughout the responses that we received. The majority of respondents reported an increase in demand for services, while funding for programs remained level or decreased. So we have an increase in demand in services, level or decreased funding. In addition to this increase in the number of people requesting services, there was greater amounts of assistance being requested and a greater reliance over a longer period of time. Several advisory council representatives reported this, in particular the food pantries, for example, not only did they see an increase, people were coming in more frequently and for longer periods of time. Again, keeping in mind that the funding is stable or increased. The hot issues, or the things that came up throughout the emerging trends, was the lack of affordable, accessible housing, and what I quoted as barriers to accessing mental health services and transportation. These were identified as serious issues by several advisory council representatives.
I got good news on transportation. The Human Service Committee of the RTA this morning noted that as of March 1st, DMH has given contracts for transportation for the clubhouses, which is a big component of that.
So representatives also reported an increase in clients presenting more complex behavioral health issues. And when I say behavioral health, that includes both mental health and substance abuse issues. And this trend was reported by several organizations, and I want, so it's not just in one sector. It was reported by Elder Services, the Tribe, Chana 27, which is a variety of public health or organizations that provide what would be considered public health type services. The Councils on Aging, so all of the COAs reported this, as well as Falmouth Human Services. So these groups represent a broad demographic and a broad array of service providers that are all reporting this increase in complex behavioral health issues being seen by clients. There's a lack of primary health on Cape Cod, and more people are using community health centers. And the Community Health Center Network, which is a member of the Advisory Council, reported that 40,000 Cape Codders, which is 1/5 of our year-round population, use one of the 4 community health centers. So 1/5 of our population is using community health centers as their primary access to health care. The county's demographics are impacting, and Christine alluded to the aging demographics are impacting service demand and delivery as more baby boomers and older adults are seeking services. One of the things that came up several times was that technology and information overload are barriers for older adults to accessing services. One of the other things that was noticed is that there's a shift in emphasis from the federal and state level from institutional to community-based care. So there's more emphasis being placed on serving people in their homes as opposed to going into nursing homes. And that led to the creation of something called the ADRC, which is the Aging and Disability Resource Center, which is kind of a virtual center here on the Cape between Elder Services and our CORD, our Center for Independent Living. And it's really a no-wrong door approach. So if you're trying to access long-term care supports, there's one number you can call to find out your long-term care options. So that is definitely a shift being, coming with funding, a little bit of funding from the state. So these were kind of the overarching emerging trends that were presented. Funding trends, the questionnaire also asked advisory council members to report on funding changes over the previous 24-month period. And the following trends were reported. So in general, the majority reported level funding or slight decreases in state, federal, and charitable giving. The level of town support overall was reported mostly as being on the decrease. That varied a little bit, but town funding for Meals on Wheels, food pantries, and Falmouth Human Services again noted decreased town funding. But the towns continue to support some homelessness programs as well as some projects or programs with the community health centers. So that was kind of a varied picture as far as town support. A trend reported by the Hunger Network is that some private foundations directed a larger percentage of their funds to basic services such as food. So that giving those decisions and prioritizing led to decreases in funding for other areas such as the arts or environment. In the area of healthcare, there's more emphasis is being placed on outcomes and patient satisfaction. And it's anticipated that there will be a significant shift in the way healthcare is reimbursed in Massachusetts over the next few years from a fee-for-service payment system to a global payment system. That's something we're aware of. Almost all respondents reported that their funding comes from a mix of sources, so federal, state, local, private foundations, charitable giving, and fundraising. And just an observation I have is that I think, these providers demonstrate tremendous resiliency and creativity and flexibility when they're trying to fill the gaps between what their funding is and what the needs for services are. Just a few bright spots. There was an influx of some federal dollars to build infrastructure and expand the capacity of the community health centers, which is significant since they're serving 1/5 of our total population for healthcare. And within the past 12 to 24 months, the Community Health Center of Cape Cod and Mashpee has expanded. Duffy moved to a new location. And Harbor Health, which used to be the Mid and Upper Cape Community Health Center, is in the process of expanding and moving into a new site, so that's all good. And these expansions will allow for increased capacity for medical, behavioral health, and dental services. The Indian Health Center and services are expanding as well. Another bright spot is that 3 organizations received some Attorney General funds to assist homeowners who are facing foreclosure. So those are Attorney General funds coming to HAC, CAC, and Legal Services. I do want to note that one thing that the council churches did report for the first time in years that they were closing their books with a substantial deficit, as more and more churches are turning to the council churches to assist with housing issues, rental assistance, things like that. And due to the timing of this questionnaire, which was in the summer and late spring, there wasn't any, we didn't ask about concerns about sequestration or about the state budget cuts or anything like that, but that is something that we're watching. And again, all 19 of the responses are in what I provided to you. It's a lot of, I summarized it, it's a narrative form, it's a really good snapshot of what's happening within each of these. And remember, our Health and Human Service Advisory Council representatives represent many organizations behind them. So we have 26 seats representing, hundreds of organizations. So just, in closing, just a couple comments. I think what we presented today affirms the direction the department's taking as far as the strategic plan that we developed and the areas that we're focusing on: aging and disability, behavioral health, homelessness, and health promotion. And I know our advisory council members would like to have more ongoing opportunities to communicate with our elected officials, and so this will be, at a minimum, an annual update with you, hopefully more frequently than that. And we also plan to meet with the Assembly of Delegates in early January and do a similar presentation. And I think the trends today also provide some direction for us as for going forward where county investment should be. If anybody has, I know you're looking to break. If you have any feedback.
Well, I know
or
that we're looking to
comments.
break, but you have a whole crew here with
Yes.
you, and if anybody has any comment they want to add before the year closes, or as Beth and Christine sort of sum this up. I guess not.
Yeah.
Okay,
Well,
I'm shocked.
I'll add
With this group, I'm shocked.
I'll add just one thing, and that is that what I'm seeing, and because of a lot of this, is a shift towards really looking at primary prevention, because that's where we're going to be able to save the most money and put people on a better path. And so I'm seeing that with the healthcare reform, prevention and wellness. I'm seeing that in a number of other avenues: suicide prevention, child abuse prevention, homelessness prevention. And so really trying to shift that paradigm to look at what can we do prior to any problems coming about that would keep them from ever occurring. So, and I really think that's going to be the key in future years.
I think it would be beneficial for for you to come back and
Absolutely,
have a
yeah.
more extensive and invite everyone here so that people can have a real discussion.
And we can have a much more of a discussion when you have that fun. Very valuable
Yes.
information, no
Is
question.
this available on your website?
Well, this is the first time you're seeing it, so
Okay.
yes, I was, I'm planning on putting on the compilation of responses, and I can put this on as
Yeah,
well.
I just think there's a lot of information people are trying to, it's just valuable
But-
information.
And the
People try to put
information
together
helps
plans.
everyone focus differently, as you were saying, focusing more on the prevention side of it, putting the resources where they really need to be. And then you can monitor that, and you have the information that really helps you do it more effectively. I really appreciate all of you coming here today and all the work that you do, truly. we all know to some degree what the issues are. The better we know them, which is the work that you're doing, the better we can provide them. So I thank you for coming and wish all of you a really happy holiday, and hope that you'll go down to the other end
Join
of the
us.
hall and join
we'll
us in
feed you
some
today.
fabulous lunch.
Yes,
We're not quite done here yet, but we'll be there shortly.
all right,
So thank you so much.
thank you,
Yeah.
thank you, and happy holidays, everyone.
So we do want to vote the minutes of December, I forget the date. Today's the 19th,
So it'll be the 12th?
the 12th, yeah.
Yeah,
Is there a
I'll move
motion?
them. I didn't have any problem.
Was I there?
Were you?
I wasn't there, was I? No, I wasn't
Well, then I'll second that. We can approve the minutes of December.
You were.
You were, no,
No,
you
you
weren't.
came
wasn't.
afterwards. You came
Oh,
Came
okay.
afterwards.
All right.
Brouhaha.
All those in favor?
Aye.
Great. Okay, and you have something you want to?
I have just two things, so before you go, I have the budget for our facilities, which is on January 2nd.
Oh, good.
And Sheila, what I'd suggest maybe is you look them over, and if you have issues, why don't you send them to me?
Hello?
Because you won't be here, and then Health Department.
Okay,
So that's the start. There's a
And
couple
when does the
others
health
there.
department come in here?
The Health Department and facilities will be coming in January 2nd.
okay, so I'll forward any comments.
And then I just need you to approve the use of the Barnstable County Superior Courthouse area for Making Strides Against Breast Cancer Walk. And that's on Sunday, October 6th, 2013.
I'll move that.
I gotta
I
use the
second
front
that.
one here.
All in
Thank you.
favor, say aye.
Aye.
Aye, opposed?
Great.
Unanimous.
Thank you.
Okay.
And that's it.
I'm gonna come back and sign these after.
Yeah, I won't be able to, I have a Purple Heart ceremony to attend at 1:30. So I can come back tomorrow and sign these.
No, I
if
think that'll be
necessary.
fine as long as there's
the
two
of them
signatures
sign.
on them. It doesn't
Okay.
really matter.
Yeah, okay. Nothing else?
No,
Nope.
we're adjourned.
There's one question.
Oh,
Yeah, well, this isn't a question. I just noticed, and I'm not sure about this flag, but all the other flags from the parking lot in were not at half-staff. And I don't know whether that's intentional or an oversight.
It's
But
probably
it
an
seems to me it
oversight,
would be
yeah.
appropriate to have them lowered as almost all the other
Yes,
flags
I
in the
agree.
area are
President Obama
lowered.
had asked for that.
that's
Yeah.
right. I
President
noticed some
Obama had
schools,
asked for that.
some
Right,
schools didn't have theirs lowered either. I noticed
Right.
that this morning, driving over
but
here.
it's
Yeah.
striking when everybody else is.
That's
that
right.
these
Is
aren't.
there any,
We have,
Call
can
we
you
can
notify facilities
Yeah. Oh,
maybe
yeah.
to do that?
Yep.
I think it's till Sunday. Is it Sunday
I'm
at
not sure.
dusk?
yeah, I think you wanted a week.
Yeah, I heard it, but I just don't remember. They'll know. 'cause
Yeah, well, they'll
they
know.
look on there's a
Yeah,
website you can
it was
look at.
really
Yeah.
executive order, so
Alright,
definitely. Okay. I
we
have to leave
adjourn.
here.
Did
We're
did
adjourned.
We need a motion to.
Oh, I thought we did have a
technically do
motion
that.
to
Yeah.
adjourn.
I'll move to adjourn.
Second.
All in favor, say aye.
Aye.